Dr. John Cromwell. I serve as the Associate Chief Medical Officer for the University of Iowa Hospital and Clinics. We're an 811-bed comprehensive academic medical center, and it's really the only academic medical center in the state of Iowa. So we serve the academic training role for the entire state and a broader region. We began looking at digital surgery platforms prior to the pandemic because of some of the trends that we were seeing in medicine going on. We were experiencing a very, very high census in our hospital, like a lot of other academic medical centers. And part of that's probably due to, we've got the baby boomers moving into high utilization period of their lives. We've had an unprecedented closure of rural hospitals around particularly states with large rural areas. And so we've been impacted in terms of the volume of patients we need to take care of and the complexity of the patients we need to take care of. And so it's really important for us to be able to manage our surgical platform smartly when we start to reach capacity related issues like this. And so we've partnered with Caresyntax for the digital surgery platform to help us to do that. Probably in earnest really got started on this past July. Honestly, when we started looking at digital surgery platforms, I think Caresyntax was the only company I was aware of who was really doing this. I think things have morphed over the last several years in what's out there, but I think the things that are unique and that sort of drew us to the technology is not just being able to capture data from the operating rooms, but the entire sort of platform around that to allow us to manage things like teamwork coaching and technical skills training. The fact that we have the ability to keep our data in association with a federally listed PSO was important to us. And so those are some unique aspects of what we're able to do with this surgery platform. Well, like I said, we're relatively early in the journey through learning how to use all of the technology. But I think early on, what we've seen is a lot of surgeons very interested in making use of the system to try to understand what is making their cases less efficient, or how can we better take care of these highly complex patients. And so we've seen a lot of engagement from a range of surgeons, thoracic surgeons, urologists, GI surgeons, in different specialties. Our sort of the key sort of activities that have been going on for us has been setting up really a coaching program that goes around this platform because of the goals we have to take us to the next level in terms of being able to coach to very specific outcomes, whether they're operational or whether they're sort of patient-centric outcomes.